is something we need to take care of. This is something, when you hear the feedback from folks who are calling our office and writing our office and calling their pharmacist and saying, I'm having difficulty finding a new provider. I can't make sense of this. I'm forced to change my provider. And there's quality and service are poor. We need to take a look at what's going on. Another pressing issue for my local pharmacists is the lack of oversight and transparency when it comes to the pharmacy benefit managers. PBMs are actually one of the least regulated segments of the healthcare market, yet they are the cause of numerous frivolous audits that local pharmacies are subjected to. Now, supporting strong PBM transparency requirements is key to delivering real savings to patients. Unlike my local pharmacists and those across the nation, PBMs do not have a real relationship with patients. In fact, it is not uncommon for them to secretly retain from most manufacturers' payments, i.e. rebates, discounts, and other fees, instead of passing the savings on to patients. Additionally, PBMs have been known to switch plan members from low to high cost drugs and manipulate generic pricing. At the end of the day, the data points to the fact that PBM market is broken. I can speak to this from my own personal experience. As I've shared before, I believe from when we talk about problems, we need to relate it to what people can understand. And for this, I can understand it through my family, but also through my parents, who have talked about how their drugs have been changed, or they've been given short notice of changes, or when they get from their doctor who gives them the prescription to take them to their pharmacy, they have a problem because they're not going to be certified because there's been a change just in the last little bit in what drug the coverage will make, and the PBMs have had a large part in that. You see, what I believe is their conduct is anti-competitive and anti-consumer, and independent community pharmacists are often left vulnerable to their market power. But there are solutions to this problem. For example, allowing the smaller to collectively negotiate will help level the playing field. The threat of antitrust liability in the status quo prevents these collective negotiations, and I believe an antitrust exemption is appropriate and consistent with past exemptions enacted by this Congress. It is with that I am proud to be an original co-sponsor of what was known as the Protecting Our Hometown Independent Pharmacies Act of 2013, which I believe achieves this goal. You know, the author of this bill, Mr. Marino, and I have had several conversations discussing his examples and what brought him into an understanding of what is going on with our community pharmacists and the problems that are developed here. And I want to applaud, and one of the things I want to do is take out and highlight members who have brought forward pieces of legislation that I believe matter to our constituents, and they matter to the American people. This is a conservative piece of legislation that brings forward and highlights a problem with our community pharmacists who are reliable businessmen in their communities, and by doing so and taking that part, Mr. Marino has helped bring forth a piece of legislation that I'm glad to support and look forward to moving forward, hopefully through the committee process and onto this floor and eventually signed into law. Now understand, there's a lot of discussion that needs to be had here, and PBMs take their fair share of blame, and there's a lot of problems in this situation. And it is something we need to discuss because it matters to the people back home. It matters to those very essence of health and health care, which we come down to this well and we talk about all the time. We talk about cost. We talk about the problems with access. This is an area where I believe we can continue to move forward. You see, there's also another pressing matter facing independent community pharmacists, particularly in Northeast Georgia, and that is abusive audit tactics. I believe, like many Americans, that pharmacy audits should be focused on uncovering actual fraud and abuse. Audits play an important role in ensuring high-quality patient care and services. Unfortunately, PBMs are leveraging their power to abuse the auditing process. They're singling out expensive drugs and using typographical and other trivial areas to recoup from pharmacies significant amounts of money, not to return to Medicare, but to line their own pockets. Now, this is where I'm going to use an example that I had a few months ago. I had a number of pharmacists from their my local pharmacists all over Northeast Georgia come in, and they met with me. And all I did was I sent out a note because I'd been hearing about this from my local pharmacists and from others, and I said, come talk to me about what you're experiencing. And like a lot of times, and Ms. Speaker, maybe you've done a similar thing with businesses. You expect maybe 3 or 4 people to show up. In my conference room, I had a full house. Pharmacists who left and drove some as many as 2 hours to come to that office to sit down and talk about the problems that they were facing. What that told me in the middle of the day is that the issues and the problems that they have were more important to them than spending time that morning and finding somebody to cover their shop so they could come talk about this, because it's affecting the very quality of their existence. Now, as we look at this, they began to give me examples. For example, let's say your local pharmacist fills a $500 prescription for you that you called in over the phone, or you had called in from the doctor's office. The pharmacist dispensed the correct drug in the correct amount and provided you the correct directions for taking the drug. Ms. Speaker, do we have a problem at this point? I don't think so. You're getting the right drug, in the right amount, in the right container, with the right label. Everything's there on what your doctor had wanted you to have. But if the pharmacist makes a mistake in his personal records and his checking off, instead of checking the called in over the phone box, he checks the faxed in box, a PBM could then, during their audit of the pharmacy, find the mistake and then take back the entire $500, not just the copay and not just the profit the pharmacy received. They take back the entire cost of the drug. Now, I've said before, there are a lot of things that make me scratch my head. This is one of them. It's one thing to come in and be audited. It's a one thing to find a mistake in which there's a clerical error. And there needs to be some correction to that clerical error. But let me go back, Mr. Speaker, and remind you that it was dispensed properly in the correct amount, with the correct drug, in the correct facility, with the correct directions on there. But however, on the paperwork, on how the call came in, how they took the prescription down, they were audited and deemed for that. And they were not just deemed for the amount of their copay or their profit even. They were deemed for the entire amount of the drug. What's really interesting about this is I've also had several of my pharmacists say it is really interesting to them that when they're audited, it's not the generics that are audited. It is the brand names that seem to be audited, the higher cost drugs that find their way onto the audit list. I think that's really interesting, because what happens is if one mistake comes, you're talking about a major cost for these pharmacists. And this is not something they can continue to eat. Now, it can be said they can appeal it and they can go through the process, but it is something over and over. They don't get to appeal it and hold the money. They have to send the money in and then appeal. Now, does that sound fair? I don't think so. I think what we've got to do here is begin to look at this problem in its entirety. The PBM could pocket the entire cost of a correctly dispensed drug, even what the pharmacy paid wholesale. This leaves me baffled. Obviously, auditing measures should be in place, but for transparency and accountability, not to financially penalize one's competitors. Oh, by the way, some of the PBMs are actually involved in the competitors to the local pharmacies in which they audit. Just a small reminder. You know, I can stand here all evening and tell you story after story of the unfair and almost unbelievable auditing practice that my local independent folks have had to deal with. One local pharmacist told me about how they had already been audited 3 times that year and they were preparing their 4th. Mr. Speaker, you know when he told me that? March. He had been audited 3 times, getting ready for a 4th, and it was January, February, March. This seems to be a problem. Interesting enough, the audits don't focus, as I've already said, on generic drugs. The audits typically look at administrative errors on high-priced drugs. This comes as no surprise. We know that the PBMs are looking to take money, line their pockets, and not care for patients. They don't sponsor baseball teams, they don't participate in chili cook-offs, and they sure aren't going to any tomato festivals. Patient care takes a back seat to profit margins. I believe that Congress should take a closer look at PBMs because in the status quo, after a pharmacy has been audited, recoupment funds go back to the PBM. This is unacceptable. In other words, you're auditing, and the fines that you get, the penalties that you get, go to you.